You start Mounjaro, your appetite drops, you feel full after much less food, and then something else slows down. At first it is subtle. A day becomes two, two becomes three. Now you are bloated, uncomfortable, and suddenly interested in your bowel movements more than any reasonable person wants to be. So why does a weight loss drug end up causing constipation, and when should you actually worry about it? I'm Dr. Kim. In this video, I'll explain why constipation can happen on Mounjaro, why it does not affect everyone the same way, what usually makes it worse, and when it may signal a more serious problem. This is general medical education, not personal medical advice. If you have severe abdominal pain, repeated vomiting, major bloating, or you cannot keep food or fluids down, you need medical evaluation rather than trying to solve this with confidence and denial. So, let's start with the main question. Why can Mounjaro cause constipation in the first place? The first reason is that Tirzepatide slows part of the gastrointestinal system. One important effect of this medication is delayed gastric emptying. In plain English, food leaves the stomach more slowly. That is part of why people feel full sooner and stay full longer. It helps reduce appetite, which is one reason the drug can help with weight loss. But when the stomach slows down, the digestive experience can feel slower too. Not always, not in every person, but often enough to matter. Some people mostly notice nausea, some feel prolonged fullness, some feel bloated, and some become constipated. That does not mean the intestines have completely stopped. It means the overall system can feel slower, and stool may become less frequent or harder to pass. The second reason is lower food intake. This sounds almost too obvious, which is probably why people miss it. If you eat much less, there is often less material moving through the gastrointestinal tract. Less food can mean less stool bulk. Less stool bulk can mean fewer bowel movements or bowel movements that feel incomplete or harder to pass. So sometimes the issue is not just that the gut is slower. Sometimes there is also simply less moving through it. It is not a glamorous explanation. But the bowel has never cared about glamour. The third reason is lower fluid intake. This is a very common one. When appetite falls, fluid intake often falls too. Some people feel mildly nauseated and do not want to drink much. Some are eating less structured meals and, without really noticing it, drinking less over the day as well. That matters because stool that spends more time in the colon can become drier as water is absorbed out of it. Combine slower movement, lower stool volume, and less fluid, and you have a very reasonable setup for constipation. And that brings up an important point. Is constipation on Mounjaro usually caused by one single mechanism? Usually not. It is often a stack of smaller effects. Slower stomach emptying, less food, less fluid, sometimes less physical activity, and sometimes a recent dose increase. Together, those can produce a predictable result. Which brings us to the fourth reason, dose escalation. Many people do fairly well at a lower dose and then become more constipated after the dose goes up. That pattern makes sense. These medications are started low and increased gradually because the gastrointestinal system often needs time to adapt. So if someone says, "I was fine," and then after the dose increase everything changed, that does not sound mysterious. It sounds pharmacologic. The medication did not suddenly become evil, it just became stronger. Now, not everyone gets constipation on Mounjaro. That matters because patients often assume side effects should be uniform. They are not. One person gets nausea, another gets diarrhea, another gets constipation, another gets almost nothing except appetite reduction. Different bodies respond differently to the same signal. That is true in obesity medicine, it is true in blood pressure treatment, it is true in depression treatment, and it is definitely true here. So who is more likely to struggle with constipation? People who already tended toward constipation before starting treatment, people whose appetite drops a lot, people who do not drink enough, people who become less physically active, and people whose gastrointestinal tract seems especially sensitive to dose increases. Now here is a question patients often ask. How can the same medication cause diarrhea in one person and constipation in another? The answer is that Mounjaro is not a constipation drug or a diarrhea drug. It changes gut signaling, appetite, and motility. Different people respond to those changes in different ways. So yes, it can push one patient in one direction and another in the opposite direction. The gut is cooperative only in theory. Now, let's get to the part that matters most. When is constipation on Mounjaro unpleasant, and when is it more concerning? Mild constipation usually means bowel movements are less frequent, stools are harder, and passing stool takes more effort, but the person is otherwise stable. They are uncomfortable, but they are not in severe pain. They are not vomiting repeatedly. They are not becoming dramatically bloated. They are still able to eat and drink. That is not fun, but it is different from a red flag situation. More concerning symptoms are different: severe or worsening abdominal pain, repeated vomiting, marked abdominal distension, inability to tolerate food or fluids, or a clear sense that the gut is not moving normally at all, deserve medical evaluation. This is where people sometimes make one of two bad decisions. The first is minimizing everything. It's fine, I'll just ignore it. The second is catastrophizing too early. This medication is dangerous for everyone. Usually neither response is correct. The better approach is more boring, which is exactly why it works. Ask, how severe is it? Is it getting worse? Did it start after a dose increase? Am I eating much less? Am I drinking less? Are red flag symptoms showing up? Those questions are more useful than panic or denial. But here is where it gets interesting. Some people assume constipation means the medication is working especially well. That is not a reliable interpretation. Feeling full sooner may reflect part of the intended effect, but clinically significant constipation is still a side effect. It is not proof of superior fat loss. It is not a trophy, and it is not your colon sending a note of admiration. So what is the practical takeaway? If constipation appears after starting Mounjaro, the most likely explanation is not mysterious toxicity. It is usually some combination of slower gastric emptying, lower food intake, lower stool bulk, lower fluid intake, and dose-related gastrointestinal sensitivity. That is the physiology, and once you understand that, the framing changes. Instead of asking, "Why is my body betraying me?" a better question is, which part of this process is slowing down, and how severe does it seem? That question leads to better thinking. It also explains why this side effect can vary so much from person to person. In one patient, it is mild and temporary. In another, it is persistent and annoying. In a smaller group, it becomes severe enough that the treatment plan may need review. That does not mean Mounjaro is a bad medication. It means effective medications can still have real side effects. And patients do better when they understand the mechanism instead of just experiencing the symptom. So here is the bottom line. Mounjaro can cause constipation because Tirzepatide slows gastric emptying, changes gut motility, reduces appetite, and often leads people to eat and drink less. Not everyone gets this side effect, and not everyone gets it to the same degree. What matters most is not just whether constipation happens, but how severe it is, whether it is worsening, and whether red flag symptoms are appearing. That is the useful way to think about it. Not, Mounjaro causes constipation, end of story, but rather, Mounjaro can slow the system down. In some people that slowdown is mild, in others it becomes clinically important. That is the distinction that actually matters. This is not medical advice. Consult your doctor.